This will have you spitting out your dinner. The Telegraph report that food labels with information such as calories in this cake require 90 minutes of walking to burn off were far more likely to be understood compared to a traffic light system. This according to a study by Loughborough University, which surveyed more than 2,600 adults who were told, for example, that a chocolate wafer biscuit with 209 calories would cost 21 minutes of running, or twice as long for anyone taking a stroll. Now, I'm against the nanny state. We've had a few years now of the government telling us what to do, so I think it's time to let people live their lives. And it's a fundamental human right to be able to eat yourself and drink yourself into an early grave if you so wish. But I think this research is potentially useful in the much-needed battle against obesity, because it's based on how I've always said we should tackle this. Information, not instruction. There's very little evidence that scrapping 2-for-1s on unhealthy food in the supermarket makes a blind bit of difference. Often diet drinks are just as unhealthy in a different way. And in terms of scrapping meal deals, are we really going to make food deliberately more expensive during a cost of living crisis when queues for food banks get longer by the day? It's abundantly clear that junk food is the tobacco of the modern era. In the 1950s, 60s, 70s and 80s, smoking grew ever more popular, and it became clear that in spite of the massive marketing behind tobacco, it was slowly killing us and burdening our health systems. A concerted effort to encourage people off the fags was highly successful. Not by banning cigarettes. People were given information, not instruction. And the rising cost of tobacco meant that you could continue to puff away, but it was going to cost you. This will have to happen with the food industry, who have adopted very similar policies to the tobacco giants. For example, nonsense, highly compromised so-called studies showing their food is super healthy, like cereal companies paying for research that miraculously confirms you need your cornflakes in the morning. Fags were at one point marketed in America as good for chest complaints, and they had adverts on American TV saying, "Your doctor recommends Camel cigarettes." Amazing! But there are parallels now with companies like McDonald's, spending millions linking themselves to Premier League football and the Olympics in order to create the illusion that their food, I use the term loosely, is somehow part of a healthy lifestyle. Because their brands sit there in the context of sport. Except I don't think Cristiano Ronaldo would have achieved that famous six-pack on a diet of Happy Meals. The painful truth is that being fat has become normalised across the Western world. Look at this cover of the US magazine Sports Illustrated, which used to be adorned by lean, athletic models. Now, this lady is very, very beautiful, but she's overweight, hardly a role model. The messaging here is disastrous. Meanwhile, this is what a Calvin Klein model looks like in 2022. Again, she's a very beautiful lady, but rocking that much of a BMI is grounds for a visit to the doctor, not the photographic studio. Here's what the typically astute commentator Dominique Samuels had to say on the matter just a few months ago. She said, "Why do we need the morbidly obese to speak their truth in their Calvins? Out of all of the black plus-size models that exist, you had to pick the one that's 5 minutes from diabetes to promote unhealthy living. Calvin Klein," says Dominique, "you should be ashamed." So how do we change things? The state, of course, must apply pressure on these fast food giants to improve their recipes and to make them healthier. These multi-billion-dollar corporations could potentially pay more tax as their products are providing such a burden on our health service. The public should be armed with more information about the rubbish they're eating so they can make an informed choice. Information, not instruction. And I say start them when they're young. Schools should be teaching what used to be called home economics. All too often, kids come out of school barely able to put a chicken tikka masala in the microwave. Teach them how to boil an egg, steam some broccoli, fry a steak or roast a chicken. Teach kids about real food. Because in the 60s, the 70s and the 80s, we did not have obesity. Why? Because we didn't snack. It was 3 square meals a day, real food, meat and 2 veg. And treats like ice cream or chocolate bars were a weekly, not a daily event. Young people now who are at the forefront of exploding obesity rates have upped the ante. They're eating crap by the hour, by the minute. Made worse, of course, by lockdowns as people stayed home and dialed Deliveroo to have this toxic slurry delivered straight to their door. We've got to tackle this crisis because things are getting worse. COVID was arguably a disease of obesity. If you had a high BMI, and that's what they call metabolic syndrome, type 2 diabetes, high blood pressure and a big waistline, you were disproportionately at risk from the virus. It's not going too far to say that if there had been no obesity, there was no pandemic. The statistics around the world in terms of the obese people in ICU, 80% in America, for example, speaks for itself. Which is why I'm afraid that the NHS asking for more money falls on deaf ears. For almost 3 years now, the NHS became the National COVID Service, obsessed with trying to stop a seasonal respiratory virus. And with that, they stopped treating other illnesses, presided over a waiting list of potentially 12 million people, and now we're paying the health price. You try getting a GP appointment this side of Christmas. Good luck with that. Your leg could be hanging off, and even then, they'd still insist on having a Zoom appointment. Obesity is the real pandemic. It's been tearing through our population for 30 years, and it's getting worse. And it's the pandemic that the government, the media, and our health service have been ignoring. A record amount is going into the NHS, and yet we're sicker than ever. And the elephant in the room is the fact that we're overweight. Linked to depression and joint problems, 30-year-olds are now going in for knee replacements, and you know how expensive they are. Obesity is also linked to high blood pressure, cancer, kidney disease, eye problems, chest issues. You name it, every major ailment you can think of is linked to obesity, a so-called illness which is entirely preventable and man-made. All the NHS want to do is manage the symptoms, expensively treating the millions in this country with type 2 diabetes, pumping people with heart problems full of statins, and spending billions a year on heart operations and other procedures, none of which would be necessary if we simply ate the way we did in the 60s, the 70s and the 80s. And we still had our treats. But look at any photograph of the public from that era, any pictures from the old days. A handful of fat people, the majority slim as they come. Take a snapshot of the British public now, and the opposite's the case. It's the thin ones who stand out. Now, I was getting quite the belly in 2018, and I followed the low-carb principles of the brilliant NHS GP, Dr. David Unwin. This is a man who gets his patients off processed carbohydrates, sugar, bread, pasta, rice, potatoes and beer. I dropped 3 stone thanks to his advice, and he has reversed the diabetes of scores of his patients. Why isn't the whole of the NHS doing what Dr. David Unwin does? These lifestyle-related illnesses are now such a cost to the NHS, they threaten, in time, to bankrupt the whole thing because of the astonishing cost of managing these chronic preventable diseases. Operations, medical devices, and, of course, medication are a massive industry that you and me are needlessly paying for, lining the pockets of big pharma. It doesn't have to be this way. Mark my words, obesity and our bulging waistline is killing us. And if we continue to ignore it, it will kill the country too. It's enough to make you sick.